I would like to have any one or two of you that could answer this question to do it. You heard me in my opening comments refer to the fact that the system doesn't seem to be fair to racial minorities or people living in rural communities. So what are your efforts underway to understand the root causes and help make the system fairer to patients on the waiting list? Explain the factors that result in the disparity for minorities and rural populations in the process, and how can the federal government address the problem if we have to be involved in addressing it?
One of the most important things that we don't currently do is we don't actually account for disease burden in terms of examining our waiting list. So we have no way of knowing if we're actually serving the correct people, if the correct people are actually making it to the waiting list. Disease burden is super important because it not only identifies the individuals who are in need of transplantation, but it also speaks to supply. So areas with high rates of end-stage kidney disease burden, like the southeastern United States, are going to have much lower supply. And they also are predominantly, those waiting lists predominantly consist of African-American or Black individuals. So if you want to make a truly equitable organ system, you have to essentially get more organs to those areas where there are higher disease burdens. I think the other thing is that we have to have more focus on how we approach donor families and make sure that we have cultural competence as a part of our OPOs and how they approach families to ensure that we're not marginalizing minority families with regard to the organ donation process.
Okay. Mr. Shepard, UNOS has responsibility to conduct oversight of membership. There's little indication that your organization is capable of doing it. If, in fact, this committee found that less than 40% of all patient safety cases are referred to the Membership and Professional Standards Committee, which is responsible for monitoring member compliance with the Transplantation Network's policies and procedures. How does UNOS staff determine what cases are referred to this committee?
Thank you, Senator. Staff refers cases to the MPSC. That's the peer committee. And again, our statute and regulation require us to use peer review to do the quality improvement work that we do. Our staff use a rubric approved by the peer committee. The peer committee have given them a set of guidance rules to say, these are the types of cases that we would like to see. These are the types of cases that, when you evaluate them, do not need to be referred to the committee. Our staff do not make those judgments independently. All of those staff decisions as to whether a case meets the MPSC rubric for referral are reviewed in a group of the member quality staff, including the Chief Medical Officer, UNOS.
Well, with the committee's findings in mind, should your organization reevaluate its oversight efforts so that more cases are referred to the committee? And if you would disagree with that, why not?
I would say one of the things that the committee, our conversation with your staff have led us to understand is that the current committee may not be as aware of some of the past decisions that past committees have made in establishing those rubrics. And so we've created a new process where at the seating of each new MPSC committee, we go over that rubric so that each committee can endorse, amend, or otherwise alter the description of what types of cases they would like to see and not simply rely on what a past committee has decided.
Mr. Friedman, in 2021, the U.S. Digital Service found that UNOS can't properly modernize its IT system and that its core systems are fragile. This is concerning, especially since the organization is the only government contractor responsible for making transplants possible. Can you give us an example of a time when UNOS's technology caused an adverse patient safety event? And generally, do you think Advent Health is getting the best value with regard to the services offered by UNOS?
Senator Grassley, I believe the IT system
Push the red button.
Senator Grassley, I agree with you that the IT system is fractured.
You're off.
Let me try one more time.
Yeah.
Senator Grassley, I agree with you that the IT system is fractured. There are situations where organs are not offered in a timely manner. The IT system that UNOS currently utilizes does not allow transplant centers easily opportunities to turn down organs or ensure that the right organ is going to the right patient. I also believe with IT technology, as I stated, monitoring organs and organ placement. When I was in the military, I did aeromedical airlift. My crews out of Scott Air Force Base knew where I was worldwide with my patient. I can't even get a kidney that's 20 miles away from my transplant center with UNOS thinking that it was in Miami when it was actually in Orlando, 20 miles away. The lack of IT systems, the lack of technology has caused harm potentially to patients or delayed patient treatment or increased the cost of care for patients. This is deplorable and needs to be fixed.
Thank you, Senator Grassley. Senator